Welcome back to part 2, active labor. So in the last video, I discussed early labor, including pre-labor signs and prodromal labor, so make sure you go check that out first. I'm Annabelle Carney, childbirth educator and physician assistant, and if you're new to my channel, thank you so much for stopping by, and don't forget to hit that subscribe button and ding that little bell down below so you don't miss any future videos. There's not much mistaking active labor. Contractions or surges or whatever you want to call them become longer, stronger, and closer together as baby continues to put more pressure on your cervix and move through your pelvis. During this phase of labor, your cervix is dilating from 6 centimeters to 8 centimeters. Now you may have heard that active labor begins when you're about 4 to 5 centimeters dilated, but that's actually outdated. In 2014, ACOG changed the start of active labor from 4 centimeters to 6 centimeters. And this updated guideline was intended to help first-time mamas avoid being given a C-section when labor is simply slower than what is considered normal. Also, during this phase, there's a lot of changes going on in the cervix still, so it's completely normal to see a lot more of that bloody show that we talked about previously. And this stage of labor typically lasts for 4 to 8 hours, although some can last longer or shorter. Active labor is when you can start timing the contractions, and this is where that 4-1-1 or 5-1-1 rule applies, meaning that contractions are now 4 to 5 minutes apart, lasting for 1 minute for 1 hour. And at this point, contractions usually require your full focus and you can't walk or talk through them, and you may feel pressure in your bottom as baby descends lower into the pelvis. And of course, there will be some lucky mamas out there who are just rocking it at 8 centimeters dilated and smiling and laughing in between contractions like there's nothing going on. I definitely wasn't one of those people, but in general, mamas tend to get a lot more serious the further she goes into labor. So after consulting with your birth team, this is also the time to start leaving for the hospital or birth center. Granted, you're not over an hour away from the facility like I was. And first-time mamas, please do not panic. If you head out at 4-1-1, you still have a lot more time than you think, and your chances of birthing your babe in your car is very, very slim. On the other hand, mamas who have already given birth should head to the facility once your contractions are at least 5-1-1, because your uterus and cervix have already done this dance before and it knows how to respond thanks to muscle memory, which tends to lead to a faster first stage of labor. If you're birthing at a hospital, this is also the time when mamas are admitted from triage to the labor and delivery unit, and also the time when a lot of mamas get the epidural, although you can get it sooner than 6 centimeters. Or if you're in triage and not quite in active labor yet, but the pain is so intense that you can't relax, they can give you another pain medication through an IV. But compared to early labor, during active labor, you'll likely find it difficult to distract yourself from the sensations, and this is now the time to start using some of those coping strategies to work through each contraction. And during a contraction, your partner or your doula can do some light touch or massage if you like that, or if you're having low back or hip pain, they can use a double hip squeeze or counterpressure technique. I also strongly suggest using verbal affirmations throughout each contraction, whether you're repeating them to yourself or having your partner speak them to you, or listening to them through your earbuds or through Bluetooth speaker. It's just super helpful to remind yourself of how strong you really are and how close you are to meeting your baby. Another thing is to remember that motion is lotion for birth. So moving around and trying new positions is key to progressing through labor. And also, don't be afraid to vocalize during each contraction, because the more relaxed your body and your throat are, the better. And lastly, as baby continues to move down through your pelvis, you will likely experience an increased pressure down there, making you feel like you're going to have a bowel movement during the contractions. And then when the contraction stops, you won't feel that same rectal pressure anymore. But when the sensation persists between contractions, it's highly unlikely that you're actually pooping, but you're likely moving on to the next stage of labor, aka pushing. And this is where pooping might happen, but it's really not that serious. And for those having an epidural, you will still feel similar rectal pressure because an epidural only blocks the pain receptors and not the mechanoreceptors, which are responsible for the body detecting pressure. So that wraps up this video on part 2 of the first stage of labor. Hopefully you have a better understanding of what's going on and what to expect in this phase. I wish you the best of luck with your birthing journey, and I will see you in the final part to the series.